Assalamu alaikum. Before you start watching this video, please check the description of the video. You will find the two links, one for the DICOM file and one for the report. Download the DICOM files and try to write your own report about this case, then compare it with the report attached in the other link. Then watch the video. Okay, this is a female patient aged 62 years old, came with a history of follow-up on a pancreatic mass. I don't have the DICOM files of the previous CT study. However, the CT report mentioned a well-defined enhancing lesion at the pancreatic head. This is the second time to face this scenario by describing an enhancing well-defined lesion in the pancreatic head. Before you state that feature, you must always compare the non-contrast phase with the arterial or venous phase, because in the other case that I will give you its story, this was not a mass. It was a huge CBD stone measured 2 centimeters, located as a distal CBD, or maybe it was something like a diverticulum, and it was initially hyperdense with no enhancement, and it came to me for a follow-up. Okay, so the other case was a stone either in the CBD or a diverticulum, and misdiagnosed as a pancreatic cancer. So in the follow-up, we clearly stated in the report that it is a stone. In this case, as you can see, there is dilated CBD, okay, reaching about 10 millimeters, as well as dilated main pancreatic duct. The CBD and main pancreatic duct have a classical anatomy. They join each other to open in the major papillae, and the minor pancreatic duct, which drains the insulin process, drain at a separate opening in the minor papilla. Okay, so this case shows the classical biliary pancreatic ducts. Let's go back. What is the cause? When I revised the printed copy of the previous CT of this patient, there was a huge, about 4 centimeter, initially a hyperdense something with no enhancement, and it was misdiagnosed as a mass. We are luckily here in the MRCP study that there is an air fluid leveling, which confirms that this lesion is not a tumor and not a stone. It is just a second part diverticulum at the second part duodenum, causing a mass effect on the biliary pancreatic ducts, causing the back pressure dilatation or the double duct sign. So be careful and always look for the duodenal diverticulum at the second and third parts of the duodenum. It is somehow not common, but you will see it frequently, and it will help you to resolve a lot of diagnostic problem in many cases, like this case. This is an diverticulum confirmed by the air fluid leveling. Let's go back to the report. We mentioned clearly that there is no pancreatic head masses, and we confirmed that also by diffusion. There is nothing, there is no diffusion restriction for any mass. And we describe the second, the diverticulum at the second part of the duodenum, measure it, mention that we have an airflow leveling, and describe the mass effect. Also, we added an image to the report because this clinical scenario will cause somehow some problem or political problems with the treating doctors or the referring doctor. So we يعني زي ما يقولوا كده نستبق الأحداث. We draw or we attach the image to the report and draw some arrows on the lesions. Okay, biliary duct, blah blah, maldilatation, and this is the second part of the diverticulum at your conclusion. Good luck.